Parkinson's disease. Parkinson's disease is a degenerative brain disorder associated with aging. A distinction is being made between Parkinson's disease and Parkinsonism, in which the same symptoms are produced by causes other than age. Symptoms start gradually, sometimes starting with a barely noticeable tremor in just one hand. The most common initial sign is a coarse, rhythmical slow tremor of the hands. It diminishes during conscious movement. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. In the early stages of Parkinson's disease, your face may show little or no expression. Your arms may not swing when you walk. Your speech may become soft or slurred. Parkinson's disease symptoms worsen as your condition progresses over time. Although Parkinson's disease can't be cured, medications might significantly improve your symptoms. Occasionally, your doctor may suggest surgery to regulate certain regions of your brain and improve your symptoms. Symptoms of Parkinson's disease. Parkinson's disease signs and symptoms can be different for everyone. Early signs may be mild and go unnoticed. Symptoms often begin on one side of your body and usually remain worse on that side, even after symptoms begin to affect both sides. Parkinson's signs and symptoms may include 1. Tremor. A tremor, or shaking, usually begins in a limb, often your hand or fingers. You may rub your thumb and forefinger back and forth, known as a pill-rolling tremor. Your hand may tremble when it's at rest. 2. Slowed movement, bradykinesia. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter when you walk. It may be difficult to get out of a chair. You may drag your feet as you try to walk. 3. Rigid muscles. Muscle stiffness, cogwheel type, may occur in any part of your body. The stiff muscles can be painful and limit your range of motion. 4. Impaired posture and balance. Your posture may become stooped, or you may have balance problems as a result of Parkinson's disease. 5. Loss of automatic movements. You may have a decreased ability to perform unconscious movements, including blinking, smiling or swinging your arms when you walk. 6. Speech changes. You may speak softly, quickly, slur or hesitate before talking. Your speech may be more of a monotone rather than have the usual inflections. 7. Apart from monotonous speech, patient develops a mask-like expressionless face and dribbles saliva because of difficulty in swallowing. 8. Muscle aches and cramps occur, fatigue is often present and constipation is common. 9. Writing changes. It may become hard to write, and your writing may appear small. 10. As the disease progresses, there may be major disability when the patient becomes immobile and chair-bound. The later may lead to complications like pneumonia, bed sores and urinary tract infections. 11. Most patients have normal intellectual function but, with time, a proportion develops structural mental changes. Causes of Parkinson's disease. Extensive microbiological studies have failed to find an infect. Other causes. Degeneration of the brain stem, presence of large bodies within brain cells, and loss of neurons in the important regions of the brain, causing severe loss of dopamine, are the main pathological changes. These important discoveries have led to treatment with L-Dopa to replace the lost dopamine in the body. The cause of Parkinson's disease is unknown, but several factors appear to play a role, including genes. Researchers have identified specific genetic mutations that can cause Parkinson's disease. But these are uncommon except in rare cases with many family members affected by Parkinson's disease. However, certain gene variations appear to increase the risk of Parkinson's disease but with a relatively small risk of Parkinson's disease for each of these genetic markers. Environmental triggers. Exposure to certain toxins or environmental factors may increase the risk of later Parkinson's disease, but the risk is relatively small. Researchers have also noted that many changes occur in the brains of people with Parkinson's disease, although it's not clear why these changes occur. These changes include the presence of Lewy bodies. Clumps of specific substances within brain cells are microscopic markers of Parkinson's disease. These are called Lewy bodies, and researchers believe these Lewy bodies hold an important clue to the cause of Parkinson's disease. Alpha-synuclein found within Lewy bodies. Although many substances are found within Lewy bodies, scientists believe an important one is the natural and widespread protein called alpha-synuclein, a-synuclein. It's found in all Lewy bodies in a clumped form that cells can't break down. This is currently an important focus among Parkinson's disease researchers. Risk factors of Parkinson's disease include age. Young adults rarely experience Parkinson's disease. It ordinarily begins in middle or late life, and the risk increases with age. People usually develop the disease around age 60 or older. Heredity. Having a close relative with Parkinson's disease increases the chances that you'll develop the disease. However, your risks are still small unless you have many relatives in your family with Parkinson's disease. Sex. Men are more likely to develop Parkinson's disease than are women. Exposure to toxins. Ongoing exposure to herbicides and pesticides may slightly increase your risk of Parkinson's disease. Complications of Parkinson's disease. Parkinson's disease is often accompanied by these additional problems, which may be treatable. Thinking difficulties. You may experience cognitive problems, dementia, and thinking difficulties. These usually occur in the later stages of Parkinson's disease. Such cognitive problems aren't very responsive to medications. Depression and emotional changes. You may experience depression, sometimes in the very early stages. Receiving treatment for depression can make it easier to handle the other challenges of Parkinson's disease. You may also experience other emotional changes, such as fear, anxiety or loss of motivation. Doctors may give you medications to treat these symptoms. Swallowing problems. You may develop difficulties with swallowing as your condition progresses. Saliva may accumulate in your mouth due to slowed swallowing, leading to drooling. Chewing and eating problems. Late-stage Parkinson's disease affects the muscles in your mouth, making chewing difficult. This can lead to choking and poor nutrition. Sleep problems and sleep disorders. People with Parkinson's disease often have sleep problems, including waking up frequently throughout the night, waking up early or falling asleep during the day. People may also experience rapid eye movement sleep behavior disorder, which involves acting out your dreams. Medications may help your sleep problems. Bladder problems. Parkinson's disease may cause bladder problems, including being unable to control urine or having difficulty urinating. Constipation. Many people with Parkinson's disease develop constipation, mainly due to a slower digestive tract. You may also experience blood pressure changes. You may feel dizzy or lightheaded when you stand due to a sudden drop in blood pressure, orthostatic hypotension. Smell dysfunction. You may experience problems with your sense of smell. You may have difficulty identifying certain odors or the difference between odors. Fatigue. Many people with Parkinson's disease lose energy and experience fatigue, especially later in the day. The cause isn't always known. Pain. Some people with Parkinson's disease experience pain, either in specific areas of their bodies or throughout their bodies. Sexual dysfunction. Some people with Parkinson's disease notice a decrease in sexual desire or performance. What are the different stages of Parkinson's disease? Each person with Parkinson's disease experiences symptoms in their own unique way. Not everyone experiences all symptoms of Parkinson's disease. You may not experience symptoms in the same order as others. Some people may have mild symptoms, others may have intense symptoms. How quickly symptoms worsen also varies from individual to individual and is difficult to impossible to predict at the outset. In general, the disease progresses from early stage to mid-stage to mid-late stage to advanced stage. This is what typically occurs during each of these stages. Early stage. Early symptoms of Parkinson's disease are usually mild and typically occur slowly and do not interfere with daily activities. Sometimes early symptoms are not easy to detect, or you may think early symptoms are simply normal signs of aging. You may have fatigue or a general sense of uneasiness. You may feel a slight tremor or have difficulty standing. Often, a family member or friend notices some of the subtle signs before you do. They may notice things like body stiffness or lack of normal movement, no arm swing when walking, slow or small handwriting, lack of expression in your face, or difficulty getting out of a chair. Mid-stage. Symptoms start getting worse. Tremor, muscle stiffness and movement problems may now affect both sides of the body. Balance problems and falls are becoming more common. You may still be fully independent, but daily tasks of everyday living, such as bathing and dressing, are becoming more difficult to do and take longer to complete. Mid-late stage of Parkinson's disease. Standing and walking are becoming more difficult and may require assistance with a walker. You may need full-time help to continue to live at home. Advanced stage of Parkinson's disease. You now require a wheelchair to get around or are bedridden. You may experience hallucinations or delusions. You now require full-time nursing care. Diagnosis and tests. How is Parkinson's disease diagnosed? Diagnosing Parkinson's disease is sometimes difficult, since early symptoms can mimic other disorders and there is no specific blood or other laboratory tests to diagnose the disease. Imaging tests, such as CT, computed tomography, or MRI, magnetic resonance imaging, scans may be used to rule out other disorders that cause similar symptoms. To diagnose Parkinson's disease, you will be asked about your medical history and family history of neurologic disorders as well as your current symptoms, medications and possible exposure to toxins. Your doctor will look for signs of tremor and muscle rigidity, watch you walk, check your posture and coordination and look for slowness of movement. If you think you may have Parkinson's disease, you should probably see a neurologist, preferably a movement disorders trained neurologist. The treatment decisions made early in the illness can affect the long-term success of the treatment. How is Parkinson's disease treated? There is no cure for Parkinson's disease. However, medications and other treatments can help relieve some of your symptoms. Exercise can help your Parkinson's symptoms significantly. In addition, physical therapy, occupational therapy and speech-language therapy can help with walking and balance problems, eating and swallowing challenges and speech problems. Surgery is an option for some patients. What medications are used to treat Parkinson's disease? Medications are the main treatment method for patients with Parkinson's disease. Medications combat Parkinson's disease by 1. Helping nerve cells in the brain make dopamine. 2. Mimicking the effects of dopamine in the brain. 3. Blocking an enzyme that breaks down dopamine in the brain. 4. Reducing some specific symptoms of Parkinson's disease. Levodopa. Levodopa is a main treatment for the slowness of movement, tremor, and stiffness symptoms of Parkinson's disease. Nerve cells use levodopa to make dopamine, which replenishes the low amount found in the brain of persons with Parkinson's disease. Levodopa is usually taken with carbidopa to allow more levodopa to reach the brain and to prevent or reduce the nausea and vomiting, low blood pressure and other side effects of levodopa. Carbidopa is available in an immediate release formula and a long-acting, controlled release formula. Ritari is a newer version of levodopa/carbidopa that is a longer-acting capsule. The newest addition is Inbrija, which is inhaled levodopa. It is used by people already taking regular carbidopa/levodopa for when they have off episodes. As people have Parkinson's for a longer amount of time, the effects of their levodopa doses don't last as long as they did before. It results in their symptoms, tremor, muscle rigidity, slowness, worsening before they are due to take their next dose. This is called wearing off. They may also notice involuntary, fluid, dancing or fidgeting-like movements of their body called dyskinesias. These movements can indicate the levodopa dose is too high. These ups and downs of the effects of levodopa are called motor fluctuations and are often improved with adjustment of the medication by the neurologist. Dopamine agonists, these drugs mimic the effects of dopamine in your brain. They are not as effective as levodopa in controlling slow muscle movement and muscle rigidity. Your doctor may try these medications first and add levodopa if your symptoms are not well controlled depending on severity of your symptoms and your age. Newer dopamine medications include dropinerol, Requip, and pramipexole, Mirapex. Rotigotine, Nupro, is given as a patch. Apomorphine, Apokyn, is a short-acting injectable medication. Side effects of dopamine agonists include nausea, vomiting, dizziness, lightheadedness, sleeping problems, leg swelling, confusion, hallucinations and compulsive behavior, such as excessive gambling, buying, eating, or sex. Some of these side effects are more likely to occur in people over 70 years old. Catechol O-methyltransferase, COMT, inhibitors. These drugs block an enzyme that breaks down dopamine in your brain. These drugs are taken with levodopa and slow your body's ability to get rid of levodopa, so it lasts longer and is more reliable. Entacapone, Comtan, and tolcapone, Dasmar, are examples of COMT inhibitors. Opicapone, Ongendes, is the newest medication in this class, receiving FDA approval in April 2020. Because these drugs increase the effectiveness of levodopa, they may also increase its side effects, including involuntary movements, dyskinesia. Tolcapone is rarely prescribed because it can damage the liver and requires close monitoring to prevent liver failure. MAO-B inhibitors, these drugs block a particular brain enzyme, monoamine oxidase B, MAO-B, that breaks down dopamine in your brain. This allows dopamine to have longer-lasting effects on the brain. Examples of MAO-B inhibitors include selegiline, Eldepril, Zolapar, Rasagiline, Azilict, and safinamide, Xadago. Side effects of these drugs include nausea and insomnia. Giving carbidopa-levodopa with a MAO-B inhibitor increases the chance of hallucinations and dyskinesia. MAO-B inhibitors are not prescribed if you are taking certain antidepressants or narcotic medications. Anticholinergics. These drugs help reduce tremor and muscle stiffness. Examples include benztropine, Cogentin, and trihexyphenidyl, Artane. These are the oldest class of drugs to treat Parkinson's disease. Side effects include blurred vision, constipation, dry mouth and urine retention. Persons over age 70 who are prone to confusion and hallucinations or have memory impairment should not take anticholinergics. Because of the high rate of side effects, these medications are less commonly used. Amantadine, Cimetril, first developed as an antiviral agent, is useful in reducing the involuntary movements, dyskinesia, caused by levodopa medication. There are two extended-release forms of the drug, Gocovri, and Osmolex ER registered. Side effects include confusion and memory problems. Istradfilene, neurons, is an adenosine A2A receptor antagonist. It is used for people taking carbidopa-levodopa but experiencing OFF symptoms. Like the other drugs that act to increase the effectiveness of levodopa, they may also increase its side effects, including involuntary movements, dyskinesia, and hallucinations. What are the surgical treatments for Parkinson's disease? Most patients with Parkinson's disease can maintain a good quality of life with medications. However, as the disease worsens, medications may no longer be effective in some patients. They reduce symptoms during on periods and no longer controlling symptoms during off periods. This usually occurs when the medication is wearing off and just before the next dose is to be taken. Sometimes these variations can be managed with changes in medications. However, sometimes they can't. Then, your doctor may discuss some of the available surgical options. Deep brain stimulation, DBS, involves implanting electrodes in the brain, which deliver electrical impulses that block or change the abnormal activity that cause symptoms. DBS can treat most of the major movement symptoms of Parkinson's disease such as tremor, slowness of movement, bradykinesia, and stiffness, rigidity. It does not improve memory, hallucinations, depression, and the other non-movement symptoms of Parkinson's disease. Only patients whose symptoms are not controlled despite medication trials and who meet other strict criteria may be candidates for DBS. Carbidopa-levodopa infusion involves the surgical placement of a feeding tube into the small intestine. A gel form of the medication carbidopa-levodopa, Duopa, is delivered through this tube. This method of continuous infusion of the drug keeps a stable dosage in the body. This helps patients who have had variation in their response to the oral form of carbidopa-levodopa but are still benefiting from the combination drug. Pallidotomy involves destroying a small portion of a part of the brain that controls movement, the globus pallidus. Pallidotomy helps reduce involuntary movements, dyskinesias, muscle stiffness and tremor. Thalamotomy involves destroying a small part of the thalamus. This may help a small number of patients who have severe tremors of their arm or hand. Prevention. Some research has shown that regular aerobic exercise might reduce the risk of Parkinson's disease. Some other research has shown that people who consume caffeine, which is found in coffee, tea and cola, get Parkinson's disease less often than those who don't drink it. Green tea is also related to a reduced risk of developing Parkinson's disease.